So the next question is, this question is regarding the technical, aspect of liver transplant. Could you please add on the procedures that involved in a liver transplant?
Okay, so the liver transplant is actually a very, very complex process, not just from the surgical point of view, but also from the number of people that are involved in it. So I'll just oversimplify this, but don't think that liver transplant is so simple because I've oversimplified it. So it starts with the number of doctors involved. So there are hepatologists like myself. We are in charge of making sure that the patient is stable enough to undergo the liver transplantation at the right time. Then there are support staff. So basically, we have physician assistants. We have technical staff, which are technical nurses, transplant nurses, who will help the patient go from the workup situation and make sure that they are on the table. All the documentation, all the clearances, everything is done. Other doctors involved include, there are specific transplant anesthetists, there are transplant surgeons. So there will be like 3 or 6 surgeons doing transplants at a time on this patient. And there are multiple transplant anesthetists making sure that, if this is a deceased donor transplantation, we just have single surgery because we just harvest the whole liver from the brain dead patient and then implant it in the recipient. But if it's a living donor surgery, we have two transplants, two surgeries, where we have living donors, part of the liver being taken out, which is known as donor hepatectomy. Hepatectomy means cutting out of the liver. And a recipient total hepatectomy, where the recipient's, the patient's whole liver will come out and part of this liver will go in. So that includes a lot of transplant anesthetists, transplant surgeons, transplant nurses, including doctors on the side who are cardiologists, nephrologists, because some of these patients might need dialysis and all in between transplants. The complete blood transfusion medicine team will be on call during the transplant surgery. So it's a huge procedure when it comes to the actual on ground situation. Apart from this, what we do is, as a hepatologist, what I do is I make sure that the patient needs a transplant. He's a good candidate for transplantation. We ensure that transplantation will give more benefits rather than more risks.